All right, everyone, welcome back. In this video, we will go over a high-yield review of drug advertisements. And a lot of this material overlaps very much with the abstract review that we've done in a previous video, but the drug advertisements can be targeted in a different way that's much more clinically focused on interpreting what the creator of the medication is trying to tell you, and synthesizing that information is going to be critical for answering these questions on exams. So we'll go ahead and get started with a few examples. We'll go through some explanations, and then we'll conclude with some general tips that should serve you well when you go about these questions. The first question here, a 26-year-old male with type 1 diabetes mellitus presents to the primary care office for follow-up. He would like to discuss additional treatment options. Based on the information provided, which of the following is most correct as far as the interpretation for this patient? A significant increase in his glycemic control should be expected with the addition of Victoza. B, there is no risk of hypoglycemia if added to his treatment regimen. C, the data is not applicable for this patient. Or D, the medication should be avoided due to remote history of cholelithiasis. I'll go ahead and pause the video if you'd like to run a drug advertisement. Okay, so for the purpose of brevity, we won't read through the entire first page here of this drug advertisement. We'll just go ahead and move to the answer. So the answer for this one is C. This data is not applicable for this patient. And so what this is meant to highlight is that in the question stem, you see a reference of type 1 diabetes, and in the text that you're provided in the advertisement, Victoza specifically mentioned that it's not used for people with type 1 diabetes. So a lot of times you will not get a clear cut, this data is not applicable because of X risk factor. They'll just have you reference the prior information in the article. A wouldn't be true given that he's excluded from the group that they'd studied. B as well. And then D, while that may be true, that it says at the bottom you see in the contraindications gallbladder issues, you know for sure that this medication should not be applicable given the comorbidity doesn't line up with what the medication is created for. That's a common way they go about testing these, is they like to talk about the exclusion criteria and those who are excluded to determine if the data is applicable for that specific patient. So we'll do some helpful tips here. So demographic patient information is often hidden but useful to remember. So in this case, in the question stem, you saw the type 1 diabetes, but in the actual wall of text, it was kind of hard to find that type 1 diabetes was excluded. And that's a common way that they'll go about testing this. And much in the same way, study exclusion criteria will often be included, whether in a table at the bottom, a little reference legend, and oftentimes they're wanting you to apply those exclusion criteria to your patients or the patient in the example, and they won't specifically tell you in the answer choice that there is exclusion criteria. They just expect you to have read and skimmed over the article to have gotten that. So let's move over to a part 2 for this same drug advertisement. Based on the figure provided, which of the following conclusions can be made regarding this medication? A, no statistically significant findings can be concluded from this information. B, Victoza 1.8 milligrams has significantly reduced mean hemoglobin A1C levels compared to both Victoza 1.2 milligrams and glimepiride. C, neither doses of Victoza had significantly lower mean hemoglobin A1C levels compared to glimepiride. Or D, both studied doses of Victoza had significantly reduced mean hemoglobin A1C levels compared to glimepiride. Go ahead and pause the video if you'd like to look at the graph and spend some time solving this one. We'll go ahead and jump to the answer for this question. So the answer to this one is D. Both studied doses of Victoza had significantly reduced mean hemoglobin A1C levels compared to glimepiride. And so the trick with these is oftentimes they can provide you tables, they can provide you graphs of varying complexity. And if you spend excess amount of time trying to solve every aspect of that graph and understand it totally, you may use all the time allotted. So the fastest way sometimes to get through these questions is to specifically look at the graphics you're given and look for the notes demarcating significance. So in this case, highlighted below, you see that the asterisk references the p-values. So there was a significant p-value for Victoza 1.2 as well as Victoza 1.8. So it's less than 0.05. And remember, if they don't give you any information, just presume that 0.05 is the p-value of significance that they wanted for the purpose of this study. And if you notice, the star triangle group, the green group, is the glimepiride as the reference, looking at the graph, and the pink and the purple are the two treatment groups. And so even though the pink has an asterisk and the purple has a different demarcator, they actually were both significant for this case. So A is wrong because you can significantly conclude information. B is incorrect. Both 1.8 and 1.2 milligrams of Victoza are only compared to the reference group, which is glimepiride. That's the essentially the control group in this case. You're not comparing 1.8 to 1.2, so that's not what this test is describing, and that's why B is incorrect. And then C, of course, we know that there's reference of significant information here with significant p-values, so we know that there is some sort of significant effect, and so we know that for this case, D is the correct answer. So keep in mind, they'll often target this material in this way, and you always need to use p-values, confidence intervals, or other measures of significance that will tell you that the data is actually statistically significant. If for whatever reason the purple one looks lower than the pink one, that doesn't mean that for the purpose of this specific question that the Victoza 1.8 was actually more effective than the pink, because there's not any statistical significance that's a reference that tells you that. So don't presume that unless you're given no statistical information at all. Okay, we'll do another part to this question. Which of the following interpretations best applies to information regarding the p-value, assuming an alpha level of 0.05? The same or more extreme results than what were observed could be expected at this probability, assuming the null hypothesis is true. B, there's a 95% chance that the results are true. C, the null hypothesis is proven true by a p-value less than 0.05. Or D, the results described are most likely due to random chance. I'll pause briefly and pause the video if you'd like to spend time thinking through these answer choices. We'll go ahead and move to the answer explanation. So the answer for this one is A. So this is the most general and the most widely understood definition of p-value. So you're basically saying that the results that you got in this study, so less than 0.05, or in this case 0.0001 for the Victoza 1.8 milligrams, or more extreme than that, or more significant, would be observed at this probability, assuming the null hypothesis is true. That's the most basic definition of p-value, and it's basically using a lot of multiple negatives, and so it can be confusing. You're not proving that the alternative hypothesis is true. You're essentially just disproving the null hypothesis. So if we look at B, we're not proving the null hypothesis true, and so we know that B is not correct. So there's not a 95% chance that the results are true. And then C, we've proven the null hypothesis false, so we know that C is incorrect. And D, it's the exact opposite. So we essentially are saying when the p-value is less than 0.05, that we are saying that 0.05 is the set value at which below we know that these results are likely not due to random chance. Or another way of thinking about it is it's the probability that these are due to random chance, assuming that the null hypothesis is true, which is very low, 0.0001 in this case, meaning that it's not likely that it was due to random chance. And so here's some different p-value interpretations. Again, the top one is the most commonly used one. So the probability that results that you got in your study will be at least as extreme or more extreme as the results observed, assuming that the null hypothesis is correct. So if the null hypothesis, which was that glimepiride was effective in the previous question, was true, then the probability of getting results that extreme, so a p-value of 0.0001, is very, very unlikely. Versus if we look at the next two, so the observed data would be obtained 5% of the time if the null hypothesis is correct. That's a simpler way of understanding it, but you may not always see it presented in one way or the other. So basically you're saying that if the null hypothesis is true, meaning that there is no difference between the medications, because that's usually what the null hypothesis is, then the data being significant would be obtained about 5% of the time due to random chance. So very unlikely. And then C, another way of saying the same thing, assuming a correct null hypothesis, the observed difference or greater would be obtained 5% of the time by random chance. You're basically saying it's highly unlikely, if the null hypothesis was true and there is no difference, that you would just get a p-value that low just by random chance. It would be very, very unlikely. And we usually set the value for the purposes of these studies at 5%. Okay, some more helpful tips here. So again, assume significance for p-values is set at 0.05 unless otherwise stated, so that if you see something less than that, whether exactly 0.05 or whether it's just below 0.05 or whether it's way below 0.05, that's the level that you're using. If it's above that, you know that's not going to be significant, and if it's below that, you know that it is significant. And then always use the legend reference information. That is usually where you're going to find the information on significance. And I would definitely highlight that information so that you can reference it later, especially when there's multiple tables or multiple graphs and you need to highlight the specific significant findings, because you'll often be comparing those graphs to the different answer choices, and it'll save you time if you can see it quickly with it being highlighted. The same thing applies for confidence intervals as well. So remember, confidence intervals, you want, if the confidence interval is about a ratio, for example, a risk ratio, an odds ratio, or a hazard ratio, you know that the confidence interval, you want to not include 1. If I say that x divided by y is 1, then there's no difference. They're equal. So that's why the null for a ratio is 1. So you want it to not include 1. Either below would mean that it's significantly lower, or if it's a confidence interval that's above 1, you know it's significantly higher. Versus a difference, so if someone asked you the risk difference or the absolute risk reduction, you know that's a difference, not a ratio. So if x minus y is 0, you know that they're equal. It's the same thing as a ratio, but 0 is the null. So with the confidence interval in the situation of a difference, you know that you want the confidence interval to not overlap 0 instead of 1. And so it can be below 0 or above 0, but if it includes 1, it's not significant. And so just keep in mind that a ratio, you'll need to use a confidence interval as 1 as the null, and a difference, you'll use a confidence interval of 0 as the null. But in general, it's the same thing. They'll reference the confidence intervals with an asterisk. They'll put it in the bottom underneath in a legend, and you'll have to use that and understand which ones are significant and which ones aren't. Let's move to the next question. A 55-year-old male presents for follow-up. He has been undergoing treatment for refractory myelofibrosis and is open to the possibility of starting Jakafi. He expresses concern about the medication side effect profile. Which of the following is the most appropriate response? A, the side effect profile has not been sufficiently studied to know of important adverse effects. B, while known side effects are present, the benefits of treatment outweigh them in this case. C, side effects such as low blood counts and infection make this medication not worthwhile in this situation. And D, the side effects are minimal and not significant enough to cause concern. Go ahead and pause if you'd like to read through the advertisement. We'll move on to the answer and go through the other choices as well. So the answer for this one is B. And so if you notice with this first part of this advertisement, you're not given any information about significance. You're not given any data or graphs. You're just given text. And so in these situations, you generally want to synthesize what they're saying in the advertisement to the best of your ability. And then you want to basically give the most reasonable response to the patient that you could think of based on what they're giving you in the question. So A, the side effect profile is not sufficiently studied. You see that there's several statements at the bottom on the side effect profile. And given that they've have those side effects listed, you can pretty much presume that they've done significant testing and found that those side effects are present. So A would not be correct in generally in this case. C, it does mention low blood counts and infection, but those are known side effects. And if they're making an advertisement about a medication, just because it has side effects doesn't mean that you can't use that medication anymore. It's just something to be aware of. So if they'd given you information in the history that the patient had some refractory low blood counts or a history of recurrent immunosuppressive medications causing infection, then you could maybe infer that C would be right, but not in this case. You're not given any information to suggest that that would be true. And then D, the side effects are minimal and not significant enough to cause concern. In general, if there are side effects listed in a drug advertisement, they're significant enough to warrant mentioning, even if it's not enough to discourage from treatment. So D is usually not going to be the right choice. And so in this case, just like in most patients, you're weighing a pros and cons battle between the pros of the benefits of the medication and the cons of the side effects and contraindications. And in this case, he has refractory myelofibrosis, as mentioned in the question, and he's basically expressing concern with the side effect profile. And so the question is wanting you to address the fact that sometimes patients may need reassurance because they've read about side effects online. And just because there are side effects does not mean that they necessarily outweigh the pros of taking the medication. So that's what this question was supposed to emphasize. So some helpful tips. So again, focus on the most reasonable choice and its applicability specifically to the patient that they give you. So if they had given you a patient that had some recurrent infection that was causing significant morbidity, then that may be a reason that those side effects are strong enough to avoid this medication. And then in that last question, you may have felt like there's not a perfect answer here, that any one of those could be true. But in general, one will stand out as the most applicable, especially for these response to patient kind of questions, where there's not going to be anything explicit in the question stem or the advertisement that'll give you information. You just infer based on the information from you kind of understanding the study, and you apply that to the patient and kind of pick the best one that fits, even if it doesn't feel like it's a perfect answer choice. Okay, we'll move on to the next part of this question. So based on the figure provided, which of the following conclusions can be made regarding this medication? A, more patients experienced reduction in spleen volume in the treatment group compared to placebo. B, conclusions are limited due to lack of study duration. C, adverse effects in the treatment group appear greater than placebo. D, the difference in sample size between study groups limits generalizability of the results. Go ahead and pause if you want to read through. Moving on to the answer. The answer for this one is A. So if we look at the graph and just try and get an understanding of what's happening, we see that on the left, we have the Jakafi group, and on the right, we have placebo. So think of this as two separate groups, and they give you a sample size under each. And remember, if there's a significant difference there between those two, keep in mind all of the things that apply to reduction in sample size. Maybe the treatment group caused a reduction in patients because of side effects or mortality or things like that. But for this case, the N is only different by 2, so we know there's not significant difference there. And then what we're seeing on the left, so always reference the X and Y axis. So we have the patients on the right or on the X axis, and then percent change from baseline. And if you look at the top of the spleen volume from baseline. And so what we're seeing is each one of these little bars is a percentage decrease in each one of these patients. And so we see that the vast majority of these patients receiving Jakafi experienced a decrease, and it looks like it's about 35% if their little estimation is kind of accurate, versus placebo, the vast majority had an increase in spleen size from baseline. And so that they don't, for the purposes of this question, give you significance. And so this is one where you're okay to just kind of eyeball it and see if there's an answer that reasonably fits what you're given here. But most of the time, if you have a graph or a table, you'll have numbers related to significance so that you don't make an incorrect inference based off of information in a picture without significant data here. But A is the most reasonable choice. So more patients experience reduction in spleen volume in the treatment group compared to placebo. Again, that answer choice didn't mention statistical significance, but that is absolutely true, because if there's 155 in the Jakafi group and 153 in placebo, we know that at least, you don't have to go and count them all out, but the vast majority experience a decrease in Jakafi and majority experience an increase in placebo. So we know that A is at least true. B, study lack of duration. So we see a week 24 up there, but we don't really have any evidence to say that there's an insufficient study duration. Maybe if the numbers, the spleen size looked exactly the same and they didn't give you the week total, you could conclude like maybe they didn't study this medication for long enough. C, adverse effects. Again, there weren't any adverse effects mentioned in this graph, and so you know that that's not what they're focusing on. That's just a distractor. And then D, the difference in sample size between groups limits generalizability. So again, that's always something to keep in mind, but a difference of a couple of patients when the sample size is as big as 150 is totally fine. If it was 100 versus 150, maybe you'd start to think that there was some limit here of generalizability based on the lack of sample size between one of the groups. So again, when you're going through these questions, prioritize highlighting and focusing on the significant and statistically significant denoted information. Read the question stem and the patient demographic to get an idea of the patient that they're targeting, and then synthesize based on the significant information, the most pertinent information from the graph. You don't necessarily have to read through the whole graph or the whole drug advertisement. You can just skim to where it is that you're looking for something, and it'll save you a lot more time that way. So we'll conclude here with some drug advertisement format and final tips. So remember that these drug advertisements will oftentimes be used in multiple pages, and they will most often be multiple questions based off of the same drug advertisement. So a lot of times it will be a 2 or 3 part question. And again, sometimes The first question may reference directly the article, and you have to go scan through the article to find the information that they're saying, versus other times you may have information like basically asking you to define a p-value, and it has nothing to do with the article. It's just solely based on outside knowledge. So both of those can be true, and these oftentimes will be in multiple pages, so don't forget to click through multiple pages if you don't feel like you have enough information. It could be a second page at the bottom, and you can click through them with arrows usually. The first 1 to 2 pages are oftentimes the general information, so the raw data, and then sometimes the graphics with the legends at the bottom. And then the last or the pages at the back are usually the side effect profile and contraindications. And remember, if it's a drug advertisement from a company, they're typically going to want to put the benefits and the pros on the front page or on the first 2 pages, and the side effects contraindications towards the back. Number 3 here, so the footers at the bottom of graphs often have information on significance, and that is going to be extremely important. So p-values, confidence intervals, etc. You're going to want to always either highlight or make a note of those in your head, because they will almost always reference that, and that will usually be the crux of what the question, at least one of the questions in a drug advertisement question, will be getting at. And last here, there will almost always be relevant or significant findings. And that may sound obvious, but if you've read through or skimmed the drug advertisement and before you get to the question, and you don't feel like you have an idea of what is significant from this article, it seems like there wasn't really anything of note, then you probably need to skim it again or double back and look at the p-values and confidence intervals. If a drug is at the point where it has a drug advertisement, it will oftentimes have at least some clinical use, even if it does have a lot of side effects or contraindications. So just go back and try and get an idea of what the main purpose or the primary thing that they're trying to tell you about this medication is. And some final tips here for drug advertisement questions. So again, you have probably one of 2 choices. You can either read the stem and the question first, or you can briefly skim the advertisement before you start. So it's up to personal preference. If you feel like you can get an idea of the personal demographic of the patient and that helps you, then you can maybe read the stem and the question before you get to the drug advertisement. But if you feel like you just want to start from point A to point B, then at least skim through the drug advertisement and don't read every last word and don't perseverate on things that don't make sense. Just focus on the information regarding significance, and you'll probably be able to get through the questions with most of the time having the right idea in mind. Number 2, when reading the question, think about applications in the specific patient scenario. So remember, they give you a patient, for example, type 1 diabetic. They give you an age range. They give you comorbidities like hypertension, diabetes. You want to highlight those things so that you can reference them later when you're looking at the questions and looking to see if the article is even talking about the same type of patient population. Next, you always want to prioritize or highlight the statistically significant findings, as we mentioned before. So that's p-values less than 0.05, confidence intervals either not including 1 or not including 0, depending on if it's a ratio or a difference, asterisks, highlights, bolded. That's oftentimes the way that they'll denote significance, and that's what you want to keep track of. When not given information on statistical significance, defaults to the common sense or logical conclusion based on a vignette. So sometimes they want a sort of qualitative explanation that you can give a patient to test your ability to explain a study to a patient in a patient room. And so the idea is that there may not be statistical information for that part of the question, and you just generally use the information they've given you, apply it to that specific patient, and you can generally find the best answer, even if it's not a totally perfect answer. So if you do all of these things and just get repetitions with these types of questions, these become more and more familiar the more you do them, and just create a pattern, go through that pattern and do it efficiently, effectively, and these will slowly but surely start to become more and more a comfortable part of the test rather than something you avoid. So if you found this video helpful or other content like this helpful, please feel free to drop a like down below and subscribe as well to the channel.